Yeah, hi. My name is Bill Sharfman. I'm a medical oncologist. I am Director of Cutaneous Oncology at Johns Hopkins Hospital. Also the Medical Director of Oncology at Hopkins at Green Spring Station, which is a large satellite of the Johns Hopkins Oncology Center. My practice is mainly devoted to the care of patients with high risk and advanced melanoma and other cutaneous malignancies. For the past few weeks, all of you and myself have been dealing with this COVID-19 crisis. In my role, I've been focused on maintaining a safe operation at our clinic and trying to treat patients who need to be treated. Um, I, along with my colleagues at Hopkins and all the affiliates, are on daily phone calls and conferences to discuss how to make things as safe as possible um, and how to minimize patients coming through the clinic and how to keep our staff safe and how to keep the doctors safe and how to keep us from spreading the virus. So but the bottom line is we're very focused on creating a safe environment um, to treat patients who need to be treated during this crisis. And, and that is what we'll continue to do in the coming weeks and months. And so far, I think we've been very successful. We're continuing to maintain a very busy treatment schedule, again, for the patients who really need to be treated. So in the practice, what's changed is we're seeing less patients in person. We're trying to do more telemedicine, which is more challenging for me and the older physicians and the younger physicians, but I think we're getting pretty good at it. We've had to postpone, postpone a lot of follow-up visits and visits we think are not absolutely necessary. Had to make decisions on which patients we really, should hold off on treatment. Um, Patients we think are compromised or older patients. So a lot of the focus is on those issues. It's difficult. We Zoom a lot. We to do a lot of telemedicine. It's not like being there. Hopefully, we'll get back to our old ways soon. And it's also difficult to not to interact directly with my colleagues and my staff. Again, doing a lot of phone calls and conferences, and it's working. We're doing it, but hopefully, we'll get back to normality soon. I think that the patients have told us in the last few weeks that they're very appreciative of the care we're taking to make sure they're safe. We asked them, to do some difficult things. We asked them not to bring anyone with them to treatment. We screen them carefully over the phone the night before they come to clinic to make sure there's no hint of them having the COVID virus. We screen them again when they walk in the door of the main building and then screen them again when they walk into our clinic. And the patients sense that, when we do all those things, they're very concerned about their well-being, and they tell us that that really makes them feel comfortable and feel good that we're running a safe practice. And also, some of the patients just require a few extra telephone calls and teleconferences to try and reassure them, and we're happy to do that. But I think I think it's quite remarkable how well the patients in general are holding up, at least in our practice here through this very difficult time.